So welcome everybody to our final interview today. And Dr. Kallenbach has been gracious with her time today. I have interviewed her 3 times, so we are now going to be a witness to and part of our final interview for this evening. So welcome, Dr. Trish. Thank you for joining us tonight.
Thank you for having me.
It's our pleasure, and I know we've got quite a few people who have been on in the past and really have been we're all enlightened every time you join us. So without further ado, let's get the show on the road, as I always say. All right, so before I get into my line of questioning, and I'd kindly ask that if you do have any questions for Dr. Trish, if you could please save them till the very end, and you will definitely have an opportunity to reach out at that time. I don't want anyone leaving tonight without their questions unanswered. And I will send a link out tomorrow to Dr. Trish's her website, which has a lot of fantastic information, articles she's written, videos she's done over the years. There's a lot of great info, and I will send that out tomorrow. And Dr. Trish is available for, I think you said, online consults or those types.
Yeah, online, online or on phone or whatever works.
Excellent. Thank you for that. We appreciate it. So Dr. Patricia Kallenbach, and we call her Dr. Trish for short because, I think we've known each other virtually long enough to be able to speak that way. So Dr. Kallenbach earned her bachelor's and master's degrees and a doctorate of veterinary medicine from the University of Florida. After graduating from said university back in 1993, she worked for several years in a veterinary practice, a conventional veterinary practice, before opening her own holistic veterinary practice in 2002. And she is going to share with us she's going to share different examples of experiences she's had over the years. This new type of veterinary clinic offered integrative veterinary care and many alternative therapies, such as veterinary orthopedic manipulation, myofascial release, homotoxicology, acupuncture, therapeutic nutrition, and frequency-specific low-level laser that had not previously been available to pet owners living in the Nature Coast area of Florida. And in 2011, she relocated her practice, the Healing Place, appropriately named, to a larger facility in Crystal River, Florida. So Dr. Trish has done extremely well over the years. She not only shares her knowledge with us, folks at Omega Alpha, she also has published many articles. There's many videos, as I mentioned earlier. She does a lot of teaching seminars with other veterinary professionals, and she loves to give back to the community, and that she does free lectures throughout the year with local clients, clubs, and rescue organizations. So it's amazing that you actually have the time to sit down 3 times with us today. So again, thank you.
Absolutely.
So my questions are starting from the very beginning of time. How did holistic veterinary care become your calling?
As a young child, I've gone over this before. I lived in a small town. We had a large farm. We didn't have a veterinarian in our county. So from very young, I just grew up around animals with how can we make them as healthy as we can, because we were poor farmers, and to call the next county and to get a vet over, it needed to be a lot. And so we had already started with, how can we do the best husbandry and everything that we can. My undergraduate, my master's degree were both in nutrition. And so I just carried that into it. And then by the time I got to the veterinary world, I had already started with just that broad spectrum before it was, cover all of those bases before we add a pharmaceutical. Had been out practicing for about 5 or 6 years, got a flyer that basically said, I can fix things you can't. And I recognized there were a lot of things I was putting Band-Aids on, as we tend to. And so that kind of just began my journey of I didn't turn my back on my conventional, like practice integrated medicine, but I just started adding more and more tools to my tool belt so that I had a larger selection of therapeutic options to make. And sometimes I took things because I would get done with all my adjusting and massage and everything else. And I remember feeling spots on this dog's body and going, these are acupuncture points. but I don't know what they mean. And I don't know what they're telling me about this pet. And so I went and took certification in acupuncture, not to do acupuncture because I do very little, but I wanted to understand what that input. It was just another piece of information. Kinesiology is muscle testing, whatever you want to call it. It's just another little piece of information that we can get from a species that can't talk to us and say, hey, my toe hurts, or I've got an upset stomach. And so I just really looked at how broadly can I expand my tools.
Now, how were you seen amongst your peers back when you decided to branch off into a more holistic perspective? How were you viewed?
By the classical veterinarians, I was a flake. Even my veterinarian that I work with, we jokingly say, I was the voodoo vet for a long time and probably still am in some vets' minds, and that's okay. I've had vets that went, I don't know what she does, and I don't know how it works. It just does. So if we've gone as far as we can with conventional care and you're open to those type of things, go see Trish. She'll tell you if she's got something that'll help you. And so, and there are others that literally have asked me to let my clients know, don't come to their clinic. They don't want to mix it at all. That's getting tougher and tougher because there are just more and more holistic options that are just being insisted upon by the clients. And then with the whole awareness of nutrition in the last decade, they're also having to embrace that. So it's becoming a more forced thing by the clients than the pet owners themselves.
I agree. We're seeing a lot more questions of people are a lot more educated now and have a lot of questions that really they should feel comfortable in asking a health professional like yourself. And I know we talked this afternoon, and you had mentioned that, some veterinarians, they don't like it when they're challenged, whereas you take on a challenge, but you just look at it in a completely different way. And you're always diplomatic and very, very professional with regards to your peers.
And it's sad that it's not reciprocated, but you grow tough skin and you go, it's okay. I've never caught anybody in slander, but I'm not overly worried about it. I put my head down, I do a good job, and I let my work prove for itself. I don't feel like I need to broadcast or announce what I'm doing. But there are times when people give opinions that other veterinarians will give opinions. And if I truly go, they're wrong, I don't have a problem, but I'm going to back it up. I'm not going to say they're a bad vet. They whatever. They just have and sometimes it's just they have a different set of information. Mm-hmm. We all filter through huge amounts of information, and we have to narrow down what we're going to choose to take on as our philosophy. And therefore, we're each going to have our specialty per se, and nutrition and just more of the holistic options became mine.
Excellent. Common health issues, and I'm sure everybody is wondering as well, and I'm sure they're pretty common here too. What are the most common ailments that you treat in animals in your clinic?
My biggest three are going to be irritable bowel, inflammatory bowel colitis, so the whole mouth to anus not working well, causing whether it be malabsorption, whether it be leaky gut and inflammatory bowel, or pancreatitis, diarrhea, vomiting, picky eating, all of that stuff, whether it be that now we're letting allergens leak into the system from that irritable bowel, and now we're seeing that reaction on the skin and in the eyes and in the feet. So, lots and lots of allergies. And because we do the veterinary orthopedic manipulation and all of that, and the massage, certainly lots and lots of orthopedic lamenesses, this, bit, and the other, as well as performance animals that are just wanting to stay incredibly tuned up so that they can perform at their peak. And, and then, sadly, I treat lots of cancer. And while I don't really say I treat the cancer, I treat the pet. If the cancer is there, most of the time the clients are coming to me when they've gotten whatever the results are, and they've simply consciously make the decision that we're not going to go the conventional. We're not going to choose surgery, chemo, radiation, whatever it is. We're just not going to choose that. And we're going to accept that may limit our pet's life, but we're looking at, do those limit the quality of life, even though it gains you quantity? And so when they come to me, I really tell them we're aiming for quality, not quantity. I'm not trying to kill the cancer. I'm trying to strengthen the body and let it live the best life it can, potentially alongside that cancer. And so we're, sadly, because we know we're seeing more cancers in pets, we're seeing more of those as well.
Yes, absolutely. Now, living where you do in Florida, do you see other hosts of different types of issues, environmentally based, maybe so that are creating issues in pets?
We certainly see all of the allergies more so than elsewhere year round because we're a subtropical region. So we have large amounts of things pollinating year round. We see lots more liver toxicities and things in general, just because we're living on a sand hill trying to grow beautiful grass and golf courses. And so there's lots of chemicals in our environment to kill bugs and to make things green, and the right green things, weed killers versus fertilizers. And so there's a lot of toxins that are in the air at high particulate levels. And while, the government says they're at safe particulate levels, the things I remind people of is they are basing it on the human being, in that we wear clothing and shower, not on our pets that are walking in it, rolling in it, chewing on it, eating the grass, and then grooming their coat as their entire body gets coated with this at a light level. And it's not that the one time out is going to tox our pet out, but what happens if they're going and playing in that park or your backyard or whatever every single day, 5 times a day for 20 years? How much, when your pesticide company goes, would you fill a thimble of it and drink it every day? Do you think you'd have problems? And so, we just kind of forget about that. So we certainly have lots more of those scenarios going on.
Okay, thank you for sharing that. And I do know that the list that we went over earlier, in addition to your formal veterinary training, which modalities are you certified in?
So I've certified in the veterinary orthopedic manipulation, which is the instrument-based non-manual animal adjusting, and somatovisceral release and myofascial release are attached to that are more looking at releasing fascia and then balancing out the whole blood supply and balance of the organs. I'm certified in acupuncture. I'm certified in human homotoxicology out of Germany, but just because they didn't teach a veterinary course and I preferred homotox over homeopathy. And I'm certified in, my human things, licensed massage therapist, certified personal trainer, functional stability specialist, which I use in the veterinary aspect as well with all of the massage and rehab that we do. I'm not certified in rehab. Just where I am, we're not going to have the market where people would bring their pet in 3 times a week for a high-end thing. But we do a lot of rehab, and we teach it to our owners to do at home. Of course, my master's in nutrition, certified in Chinese herbals, but I don't use it, certified in my acupuncture. And things like my laser, certified in ozone. Our laser therapy doesn't have a certification. I've taken extensive training in it.
So I guess the question should have been, what don't you do?
Yeah. There's a few more things out there I've got to learn. I've got a few more years to learn them.
Oh, absolutely. Absolutely. You're not done yet. Not even close.
In the process of relearning my ultrasound from equine to small animal.
Good for you. Now, with regards to how do you decide when a pet's before you? How do you decide which modality, based on all the tools in your tool belt, so to speak, that you're going to be using for that particular client?
I tend to find that each of these modalities, while in individual practitioners' hands, they can do lots of different things just based on what that practitioner's innate talent is per se. But I really we have to look again back to that holistic approach. What will the pet tolerate? If the pet's got crazy sensitive skin or really inflamed muscles, potentially acupuncture will be just way too stimulatory for that pet. And so we may fall back and do laser. If I've got a pet that has really bad appetite issues and GI issues, I may have to fall into homotoxicology rather than doing herbals. And so if I've got a 90-year-old person that can't do all the things that I need in one modality, I may have to pick another. So we really look at, what options do we have that may work best based on that individual's problem. And then we'll look at what do we think that pet's going to tolerate. And then we look at what can the owner do. We had a dog with cutaneous lymphoma. It had been treated by a local vet with just antihistamines, had lumps about this big all over its body, big tan Mastiff dog, and for a second opinion. And with looking at it, I said, I'm just going to be really sorry to tell you, but your dog has cutaneous lymphoma. This is not hives. It's been too long. They've done mass doses of steroid. They've done antihistamines. And I said, I can't confirm that without a biopsy, but I'm just telling you what that is. And so we sent her off that afternoon to an emergency center that was right by us. They could get the biopsy. And then she came back and we said, well, it'll take them a week to get that back. Let's start ozone therapy. And so we started rectal ozone therapy, and we had done, I think, 3 ozone therapies. By the time they got the confirmation back, we had maybe done 5 or 6 by the time she went to take the sutures out. And I would say 95% of all of the lumps were gone.
That's fantastic.
And we got that. The dog came in once a month, I think, for just a simple rectal ozone, and stayed for years with just that.
That's amazing. I loved, and I know you were looking at ozone years ago. What's involved with that actually? How would that work?
It's a very easy device, and there is a company that sells one that is FDA certified and meant to be sold to your client, so your client can go home and do this. Because if I've got a cancer pet, they're going to need that rectal ozone 5 times a week, 5 days on, 2 days off. And so they don't need to be coming to my clinic and stressing the client pet out and dragging them all the way in, when they can, and paying, whatever, depending on where you are in the world, $35 to $50 for a rectal ozone. But for about $1,000, they can get their own unit. It's meant for them at home. You write them a script for the oxygen, and you show that client how to do it. And so they can, because they're going to do it for the rest of that pet's life, whether it be their allergies or their cancer. If we find it successful, they're going to do that forever. The frequency may vary based on the situation. So we have a second unit that we rent out. And so we talk to them. If the owner decides they want to do that, I go, okay, well, let's rent you our little whole kit and caboodle. Let's get you home, try it out. If you, the pet, the husband, whoever is helping out, if this all works well, we'll get you with the company to buy your own. And it's based on the premise that our entire intestinal system is lined with lymphatic tissue for the rectal part. And so it's just a gas. You use tanked oxygen. It goes through an electrophoresis or an electrical stimulation, which disrupts the oxygen molecules, which are O2s, and they tend to form into O3s. But they're highly volatile, and they're running around, and they beat into each other, and they really want to become O2. So they'll break down back into oxygen fairly quickly, usually within 20 to 40 minutes, depending on temperature, humidity, things of that nature. But you make up this gas, you put a small catheter up their booty, and up the hatch it goes, hold their tail down for 5 minutes. And what it's shown to do is it interacts with the immune tissue to basically kind of upregulate the immune system, to kind of give the immune system a little bit of you need to go do something, you're not paying attention to it. But then it immediately degrades down into that oxygen, so then it absorbs across the tissue, and it hyperoxygenates the tissue. You can also do it intravenously, where we put a catheter in, a sphalic in their arm. We pull blood, a certain amount of blood from their jugular. We make the ozone and mix it right with their blood and all the immune factors that are in that. And then we put that right back up a catheter. I've put it down ears, those little ear cones for dogs with yeast infections, because anybody who's ever used gas sterilization, you're using ozone. Ozone is 100% antibacterial, antifungal. And so we've used gas sterilization on our surgical tools and surgical rooms and everything for a decade or more. All we're doing is now looking at what can it be done, what can it do, delivers directly to the body. You can bubble it through water and drink it. You can bubble it through coconut oil and use it topically. You can't breathe it. Ozone is irritating to the mucosa of the respiratory tract. So you do have to be careful that you're just not ozonating and letting it release into the thing, because it can really it'll microscopically give issues, but long term they tend to feel it does irritate the mucosa. But there's just a lot of things you can do with it.
That's excellent. Thank you. That's fascinating. Wow, that's great. Thank you. Okay, starting on the right foot, and every pet owner wants to do right by their pets. So, and you talked about this earlier today as well, that more and more people are becoming more and more educated, and they're asking different types of questions. For people who are moving to the side of a more holistic standpoint, what types of things do you like to educate them on to start off on the right foot?
We always want to start off with general nutrition. Are we on a good nutrition? Do we need any other gut support? probiotics, digestive enzymes, any other bowel support to just get, do we have the right ingredients and can we get it into the body? Because, you know, none of us question if we're living at a McDonald's, driving through to, you know, some kind of fast food to have food 3 times a week. We're not going to question that we're not going to have the best health and we're going to have more medical visits and medical issues. And, you know, it's the same thing with the pet. And I, you know, as I said earlier, the thing most people don't realize, at least 20 years ago, was that everything that was in that grocery store aisle, feed store type of pet food, everything in that aisle failed inspection for human consumption. So it was the pet that died in the field, the chunk they cut off because it was cancer, or all the refuse that was left over once they got all the usable nutrition off for human consumption. And so, you know, I tell people, you have to realize that everything you're feeding your pet didn't even make it to a McDonald's Big Mac, kind of one of the poorest forms of nutrition I can think of. And so that's our starting point. And we can have a whole lot of problems that we're continually trying to fix, but we're continually causing them with every scoop that we feed our pets. And so I do tell people, yeah, let's back it up. Let's make sure we're eating a somewhat healthy food. I tell people, my rule of thumb is look at the ingredients list. If the first 2 words had a heartbeat, I don't care what protein there are. I just want more meat in the bag than anything else. If there's no wheat, corn, and soy, I don't care about the grain-free. There's nothing wrong with some rice and oatmeal and things of that nature. Wheat and corn and soy are just very poorly digested and processed, and they create a lot of inflammatory factors that going on in the gut. So we just don't need them. And, you know, and then we don't want byproducts in the food, just because what is a byproduct? When we process food for human consumption, everything that was left over, so beaks and feet and hair and whatever, that's a byproduct. So there's with the improvement of human processing, the sheer usable nutritional facts that were left on that carcass that they came and got and made pet food out of dramatically diminished. And so it really did hit the dregs in the, you know, early 90s or so. And so a lot of these new little pet foods came out where they really were just using quality ingredients, making pet food for their own pets and their own neighbors and neighborhoods, and they became businesses. And that just became more. And so, yeah, as the clients are getting more educated, they are starting to question the veterinarian. And we've talked about, you know, in my veterinary college at the University of Florida, we got 1 3-hour afternoon of pretty much a sales rep for Science Diet trying to tell us how it was the best thing since sliced bread. And when I asked very specific metabolic nutritional questions, having just finished a master's in nutrition, they couldn't answer these questions. And so I tell people it's alphabet soup. You know, if you have intestinal problems, feed ID. If you have dermatological problems, feed DD. But without well, how did that fix it? And how do you, what happens if you have 2 problems? Do you just mix the foods and hope half either way? And they don't even pay attention that these all interconnect.
Mm-hmm. No, absolutely. Thank you. And, you know, this is, and I say you're a rarity. I've been calling her a rarity, calling you a rarity, I should say, but I say it in the kindest way because you don't see veterinarians nowadays that have such a strong background in nutrition like Dr. Trish, along with her conventional training, of course, and then with the holistic practices. So definitely it's a positive thing. It's a compliment. So I think that's why people who come on, including myself, would love to clone you and bring you to Canada, but she will not come because of the cold weather. We've gone over that before.
What do you got like 1 month in Florida warm weather that I can come up to. Meet me in the Bahamas or whatever. The
of
Caribbean.
course.
We'll go down there.
Of course.
You know, and the other thing we have to realize is sometimes we have holistic practitioners that have completely gone into the extreme as well. And so again, I think integrated medicine is where it needs to be. If we need a conventional medicine, we can recognize it has a short-term value, but not a long-term value in some circumstances. And potentially it buys us time to get to the root of the problem with the holistic. And so, like I said, in my hands, I think integrating whatever needs to be done to make that pet the healthiest it can be is the optimal pet care for that individual.
Yes, I always believe we can all play nicely in the sandbox. Not everybody agrees, but that's what we're striving for.
Yeah.
It's all good. And I know sometimes you like to get down on the floor with the animals too, but what do you enjoy the most about following a holistic approach to health for the animals?
I guess the two primary things is I love to educate. So I really like that when my clients come in and they've been told their dog has whatever, X, Y, or Z, or my dog's itching or my dog's whatever, and I can't seem to get it under control. The fact that I can really break it down into, okay, well, this sounds like this is happening and that'll lead to that and that'll lead to that. And that's why you're seeing that. And because conventional care may just be putting a band-aid on that, but not addressing these underlying things. That's why it keeps occurring. And so really to get those kind of aha moments, light bulb going off in that client, to just really understand what's going on with their pet so that they have a better understanding of what their forward pathway can be, is just really, really enlightening. You know, ego or otherwise, the secondary thing that just, you know, it delights all of my staff really, is when we get those clients that come in and they have been given the dearth of a diagnosis of there is nothing else we can do. You need to put your pet to sleep, or it's just going to suffer through whatever, this as high as we can get it. And when we can do some things and really turn those pets around and increase their quality of life just significantly, sometimes remarkably, it's just amazing. I just had a dog that came in with this huge tumor on the side of its leg, and it was an older dog, and it's in a place where taking it off is going to be very difficult, and we won't close it. And you know, it had split open and all of this stuff. And I said, but you know what? Let's do this. Let's put it on some antibiotics. Let's do an herbal anti-inflammatory. Let's do an ozonated coconut oil. We'll see you back in a week. And so we measured it very carefully with calipers, because I don't guess with, I think it looks smaller. I want true science. And we just came back a week and it's like 70% smaller.
Wow.
And I'm like, okay, well, we already stopped the antibiotics, so let's keep on the herbal anti-inflammatory and let's keep on the topical ozone and go forth and live. I mean, the dog's 13, 14 years old. And so now we've got this soft little growth on the side of its leg instead of this big thing that's on the side of it. I don't care what it is. I didn't aspirate it. I didn't diagnose it. I don't care, because there's not a good way to get it off. And they weren't going to go for an amputation, and they weren't going to go for all the aggressive. They'd already made all those decisions that if it came out something awful, they weren't going to do all the aggressive. At that point, I'm like, well, it's not hurting the dog. It's just hanging there. And you're just trying to go, I don't want it to get bigger and start causing pain or spread or whatever. So let's go along this. And the client's ecstatic.
Excellent. It's not, that's a high I can see with the whole group there at the clinic.
Yeah.
You know, that gives you a boost and makes you feel happy. Of course, that's understandable. I love those puppies. I have to say, they're so cute.
These are Jen's puppies.
Okay.
So Jen raises Catahoulas, which is a unique, really laid back hunting dog of the South of America, Southeast of America. And so she raises them. So these were a couple of her puppies that came in that we got to play with while we were doing health certificates.
Oh, gotta love that. That's one of the big perks of the job for sure.
Yes, just having puppy moments.
Yes. So you take the good with the bad. So what the next question I have for you, you know, on the more difficult days, what are some of the difficult thing, or one of the most difficult things anyway, that you encounter when you know, basically branch out using the holistic methods?
You know, sometimes I think the internet can really add burden to people. So the Dr. Google is out there, and they just can get overwhelmed with so much holistic options out there that it can really be overwhelming and hard for them to settle into what's a course and should I try and do everything or this, that, and the other. So that can be something to contend with. There's so many supplements out there that I really had to draw the line at just not trying to investigate every supplement on the planet. If they ask me to, I can just say ingredients look good. I don't know the company. I can't tell you, you know, give you a valid quality and everything of that nature. And so, you know, that has its difficulties. The person not taking long enough, you know, we've been around in our classical approach of here's a bottle of pills and in a week or so your pet will be significantly better, even if it didn't fix it and you take them off and they come back. Sometimes getting them to understand that slow, methodical, we're trying to get to the root of the problem issue is it takes a little hand holding and a little stress on both ends of that to get that going. Unrealistic expectations is certainly something that we have to settle them in. You know, if they come for me to heal their dog, I tell people I don't cure cancer, and I don't cure irritable bowel, and I don't cure thyroid disease, and I don't cure arthritis. I figure out what's the best combination of modalities to keep that as controlled and keep that pet's quality as good as we can. And so we really have to, what are you looking to get out of this? And do I think I'm going to meet that? And if not, let me get you to somewhere else.
Now, I can imagine when people come in from going to or just moving into the holistic side of things, the initial consultation, I mean, that must just floor your clients because they're used to coming in quickly, getting out quickly. How would that look in your clinic?
Yeah, it's they're there for an hour or to an hour and a half, usually 10 or 15 minutes to just get all their documents and everything we need and all the files and get me to review them. And then I'm usually with them for a good 45 minutes. And we're just discussing how long this has been going on and how many other things have been coming up and what's all the things they've tried and what worked and what didn't and where do they want to go with this. And then I start putting together, here's some of the things I think we need to try through. And it can be overwhelming. And so I've had to really work at getting it to where it's a 3 or 4 stage thing. We're going to try these core basic 3 or 4 things or 2 or 3 things, and we're going to reassess in a couple of weeks and see what worked and what didn't. And then we'll add the next set is. And so not only is it not just overwhelming to the patient when you do it that way, we're also looking for what's more economical. And so if I start you on 12 million things and your pet's better, how do you know which one to fix? And all of those 12 million things can have cost. And so if we tend to say, unless the pet's in some kind of horrible suffering circumstance, let's do these and let's see in 2 weeks. And then we'll know what that helped and what that didn't unique to your pet. And then we'll go to this next step and go to this next step. Because I do explain to people in conventional care, 100 dogs come in with diarrhea, you treat them all the same way. In holistic, there may be 20 or 30 or 100 different reasons why they have diarrhea. And so we have to treat them differently. We may use a masking chemical to just go, please, here, take some metronidazole, stop spraying the walls with diarrhea. But there may be many, many different reasons for why they're having that physiological stress. And so we've got to figure that out and unique to that pet, get to the bottom of it.
Yes, managing the expectations, I think, would be a really big one. That'd be at the top of the list, I would imagine, because, they're used to getting a pill for fixing something quickly. And with nutraceuticals or anything else, it doesn't happen that quickly.
Cost factors into it. And sometimes when it's okay, this is going to take a lot of visits and a lot of supplements or whatever it is, or treatments or whatever, you can go to your vet. They may charge you $300 for, maybe a touch of blood work and a pill, and they'll see you next time it happens, kind of thing. And, in those circumstances, a lot of times mine is more expensive because I may be seeing you a whole bunch of times before we get to the bottom of it. On the flip side, I can most of the time can get a dog nearly completely rehabilitated from a cruciate ruptured well before they've ever spent half of what a surgical intervention would be. And they've got a fully functional dog without all of the arthritic complications that happen from simply putting a knife to a knee.
Absolutely. That's great. I love hearing stories like that. We all do, I think. The importance of supplements. And I always say to people, supplements are only part of a regimen. You can't just, give this to a cat or a dog and cross your fingers and hope for the best. And this is where Dr. Trish is going to enlighten us even more on, what she would look, well, just from a supplement perspective now anyway, just targeting mobility issues. And I know we will talk about other things as well, but maybe if you could explain to the group what you would normally recommend for a pet with mobility issues.
Well, and so we want to start with that young, really, really active dog. Maybe they don't have mobility issues yet, but they're running agility, or they're that Jack Russell that's, either sleeping or running and, banging off everything. And so we can look at those individuals and go, you know what, they are just having more impact and wear and tear on their joints. And while they may not be creating problems, they are going to be using up or wearing down their cartilage. And so to put them on something like the glucosapet, so that we're just providing nutritionally more of the building blocks to keep rebuilding their cartilage, because they're just bonging it up a lot, is that individual before they even get mobility issues. If we get that individual, now they're getting into the 5 or 7 years of age. We know that a significant amount of animals have a small amount of arthritis somewhere in their body by then. But that dog's not a high impact. It's the little poodle that goes for a walk with mom every morning or whatever. That one I may do the sinew pet that's got some of the other things for joint issues, but it's got a little bit of the glucosamine and all of that together. If I've got that 5 to 7 year old still highly competing impact based agility herding whatever dog, I may be doing both. I may be going, I need all the components from the Sinuflex, but I want a bit more of the glucosamine sulfate just as the building block. So we may do both. When I get into a point to where now I've got an injury and that pet is sore, I may use one or both of those depending on the circumstance, but I also will bring in a third product called Easy Mobility, which is another one of your supplements that has a bunch of herbs that are anti-inflammatory to soft tissue. So if they've got muscle pain, if they've got, fluid retention in joints and things of that nature. So we can really look at, what is going on. Is this a dog that's just going to be prone to them? You get that young dog that's not a big impact, but the corgis and the Dachshunds that have just more angular deformities that going on, their wrists and ankles, their carpus and tarsus are just really from their normal pelunking along the road and everything are going to have more issues. And so for that young one, even though we're not having the impact, I potentially do the Sinupet for them just because I know they're going to have more stuff going on just to get through their day.
Mm-hmm. Absolutely. And maybe you can talk a little bit. I know you love talking about the probiotic 8+, so I'm just going to let you go to town there.
Yeah. And because, the flip side of that is we don't know what all contributes to arthritis. When you talk to humans, they talk about they can have good and bad days on their gut and their arthritis is worse. Well, we know it's well documented in the human world that when there's inflammatory factors being generated in the gut from irritable bowel or whatever we want to make, the interleukins and prostaglandins and things get in the bloodstream, they travel through the body, and we have receptors for those everywhere. And so they can, while they may not be causing the arthritis, they simply turn up the volume of the arthritis. And so I tell people, yes, we want to get them on a good probiotic. I like the probiotic 8 because it not only has the 5 top organisms we want, it has some herbs to calm down some irritable bowel. It has the apple pectin and psyllium for kind of the back end colon care. It's got a touch of the enzymes that's really, I tell people it's for mouth health, of breaking down that biofilm to help with dental care. It may not be enough if you've got a pet with significant pancreatic insufficiency, but it's really great for cats. I seldom have to add enzymes with them above and beyond the probiotic. And so I'd look at, yes, if we've got that arthritic dog, if they're coming to me for adjustments in this, bit, and the other, I may not be a primary thing about, you may think about your food, but I certainly do tell people, realize wheat and corn promote a lot of inflammation in the body, and it may not be the direct cause, but go home and look at your food, that it may be at least contributing a little bit. Again, is it turning up the volume of those joint issues you're having? And, and can we do something about it? Secondarily, with the probiotic, why would we want perfectly healthy dogs on something that's got an herb that calms down irritation? Because they go outside and they play in that toxic stuff we call plants that are sprayed with all kinds of crap. And so they're chasing their toys through them and licking their feet and getting all of that stuff on their coat. So even if they're the healthiest dog in the world, they are consuming products that are irritating to the gut. So why wouldn't be on a regular basis? And my God, puppies, everything goes in their mouth. Like, the puppy's going to get it pretty much every meal. And once they kind of get over those terrible twos of everything that's going on, then we can think about, does that pet need it once a day? And if I've got a fantastic, healthy pet, maybe they can get by with 3 times a week, just depending on the circumstances. But like puppies, they're just like kids. Everything goes in their mouth.
Absolutely. And what are your thoughts on giving more than what's recommended? Because, we talk about everything being dose dependent. What are your thoughts on giving more probiotic 8+ or Sinupet or Glucosapet? What do you think about that?
The great thing is that they're all safe. It's a plant, it's food. Your body does not care whether you eat 4 pounds of spinach or a half a cup. It is food. And so your body will use those nutrients in the way that they want. And if they don't need it, they don't use it. But it's still just a nutrient. And, for the probiotics, I tell people that is your dog. My dog eats something stupid and gets diarrhea, medicine for the weekend. If you give a maintenance of whatever, a little half of a teaspoon a day or 3 times a week or whatever, and you've suddenly got a happy puppy that's blowing out, quadruple that stuff. Go to like a scoop or 2 scoops twice a day. You can't do too much because it's got the herbs to calm down the irritable bowel. We've got irritable bowel. Let's give a whole bunch of that. It's got the apple pectin and psyllium to kind of control and bulk up and get the bacteria back under control with the probiotic. I go, it's got everything we need. So just power through it. I go, there's your healthy Pepto-Bismol, if you want to call it. And so we can wax and wane on these products. Same thing if I've got a pet that's just mildly sore from an agility event, the easy mobility, the sinew pet, I may use at dose. If I've got a dog that has just really flared something up, then yeah, it's an herb. Let's double the dose and do it 4 times a day. And just what's it take to get that inflammation down?
Perfect. And thank you for answering that, because that is something that I know there's a lot of hesitancy out there for pet owners, that, you know, I got to stick with what's on the label, and oops, I gave like half a teaspoon too much. Not to worry, as you say, and now we've all heard it from a holistic veterinarian, and I appreciate you clarifying that with regards to dosing.
And again, sometimes it's how bad is what you're trying to use this herb to heal. If you've got a dog that just barely has a little flatulence, maybe a little gurgling in the gut, but otherwise feels fine, a normal dose may get that pet under control. It may be a little bit more than the dog that's perfectly healthy. You get a dog that's having a big problem. Again, why would you not use more? You get that dog that's got a lot of the chronic GI issues. That dog, those people are going to keep some of the healthy pet in their fridge at home, because that's the herbals that are more of those anti-inflammatory specifically for the gut. So, okay, if we've got that pet that's really prone to it, or they eat stupid things or whatever, that would be another thing that I'd say, okay, let's keep that in the back of your fridge for those crazy days, because we all know it happens like Friday night, Saturday morning, and you're off to spend half your gross revenue at an emergency clinic.
Yes, it seems to happen that way, doesn't it? You're absolutely right. Thank you. Because we like to hear about how you're using these in a clinic situation. I know people get very excited about that, me included, of course. And I know you're very picky about the supplements and the types of pet food you bring into your clinic. So we're very thankful that you bring in some of the omega alpha pet supplements. You also, I know, bring in our human and equine, and your sister. Again, we talked about this earlier, maybe doing an interview with both you and your sister, because your sister looks after the equine as well as you do too.
Yeah, so we have a training and facility about 45 minutes south of me, and so we have TheraPlate and laser and the adjusting and all of that stuff. And yeah, we rely. I mean, you walk into our feed room and it's just like it's an omega alpha grocery store, because it works great. I mean, your Gastrogard. I've gotten animals off the incredibly expensive ulcer treatments, and I can get them down on like 30 to 60 cc's of that, and the animal is perfectly fine and back on board. And it's a more natural way to heal. It's much more economical. It doesn't run all the side effect risks. So there's just the probiotics, same thing. It's just amazing how much of, can we just make the body healthier rather than waiting to block the symptoms of the problem after it happens.
And this question could be for all 3 product lines for that matter. What do you like about the omega alpha supplement line in general?
I always, again, as a master's in nutrition, I'm always looking for, give me your quality checks. How are you checking this out? Where are you sourcing your products? How do you make sure that every batch is as good as the last? How do you determine that these batch of the ingredients actually does what you claim it does? And so, to have clinical trials that you can pull out, to have in-depth research that potentially other people have already done clinical trials or done it at the biochemical level, just to have that data behind the omega alpha means a lot to me. Secondarily, the combination products, I use Chinese herbals very rarely, but I'm trained in that as well. But my one hesitancy with that is they train it for like a medicine. So, okay, you're going to take this 5 tablets and this 7 tablets of this and 10 tablets of that. And so that's already a lot to try to get into that dog or cat or whatever. But then they're not fixing a problem. They're having a circumstance of just balancing a balancing act of the symptoms, and I would rather fix the problem and see if that can get there. And so I really want, and then that symbiotic relationship, that it's not just a random group of things you're putting together, that, you know, again, you're using your background in research and clinical trials and the information that's out there. They go, well, this helps the liver in one way, and this helps the liver in a different way, and this helps the liver in another way, and this helps the body to digest and absorb all of those better, or process it, or deliver it to the cellular level better. And so basically we end up using less product, having better results, and it just being something that's affordable and doable for the client.
Excellent. Thank you for sharing that. And we're going to get into the food. I do have a question here. Oh, yes. You know what? This is a good, Margaret, I'm going to ask that question at the very end. Margaret had come to me for a question about the anti-inflammatory. I'm going to ask you this at the very end, but that's okay, Margaret. That's a very good, I think this is a perfect opportunity when we get to the Q&A section. I'll ask Dr. Trish about that. It's about anti-inflammatory, and I'll get to you about that. The power of food. And when we talk about, I mean, we could spend hours just talking about this one question, because this is really the cornerstone really of canine and feline health, in my opinion. But with regards to diet, maybe you can educate the groups with your extensive knowledge of nutrition and how that pertains to overall health of an animal.
Yeah, and we do start with, okay, we are what we eat, so we've got to start there. And if we're eating crappy food and we're having to buy $9 million worth of medicines and supplements to fix the problems that food is allowing to happen, or deficiencies that are happening, you know, that seems like a foolish way to go about it. And so we do want to start with better basics and better ingredients. Things we have to consider is, you know, the canine is a carnivorous omnivore. The feline is an obligate carnivore. The feline does not genetically make the enzymes to break down simple carbohydrates. So why in the world do we have grains in cat food when they can't digest it? Why do we think we have an endemic of diabetes in our pets? Because we're feeding them simple sugars out the wazoo, and we're just fatiguing. We're just stressing out the islets of Langerhans and the pancreas that were never meant to do that level of things. And so, yes, we're creating medical issues. You know, we're not even getting into the cancers and things of the crap, but just medical issues by feeding the wrong balance of things and stressing their bodies out is a scenario that we have to look into. And so we want to look at, what's the quality? Is it right for that species? Now, there's that circumstance of, you know, do I feed my Chihuahua like a wolf? Nope. So far from that, but are they still roughly a 60 to 70% carnivorous omnivore? Absolutely. But dogs have the genetic ability to make amylase and to break down carbohydrates that cats don't. And so, you know, we have to look at, you can feed a cat dog food and dog cat food, but you know, in good quality food, but they may not be balanced in what we need. And so we have to start with that, and then add supplements on top of it. You know, between we go to the home prepareds and the raws and the all of that stuff, and versus kibbles versus cans. Our cats are these obligate carnivores. They get their water from their food. So I'm not a big dry food advocate for cats. We can put a little down for them to nibble at night, but I like a predominant to be that wet food or fully hydrated food in whatever way. The canines do have a thirst center, and so they'll drink up to it. We just have to look at what's the pet's problems. Raw food is great, but raw food is harder to digest than cooked food, because the heat breaks down some of the nutrients. And so I may have some pets with just irritable bowel and poor digestion and pancreas that's not great, and all of these things. That raw food may be great, but it's not great for that pet. And I always, you know, we don't know what's going on in our clients' home lives. And, you know, there was only one study, but that looked at dogs eating raw food, and they looked at the circumstance that when they fed the dogs raw food and they looked at their feces, yes, those feces had lots more of the organisms that we were worried about, the salmonella and E. coli and everything. Well, in my mind, that means the dog's gut did exactly what it was supposed to do, kept the bad things out, and they passed on through. But we also have to consider that we're living with these animals, and with the amount of immunosuppressive medical adjuncts going on, whether it be organ transplants or chemotherapeutics or anti-whatever for every allergen you have going on to suppress your immune system these days, yes, now I look at, you can have a subset of people that cleaning that litter box or walking outside barefoot in their lawn where their dog defecates. There's at least the possibility of potentially that individual is a little bit more at risk if they aren't really dutiful about keeping things maintained. And so I at least have that conversation with people when they talk about raw, going, I'm not your doctor and I don't need to have any of that information, but I do want you to recognize if you happen to have somebody immunosuppressed, whether it be your 99-year-old grandmother or your 1-month-old grandbaby that's living with you, or you've got your spouse had an organ transplant, you just want to take that into consideration of being really, really meticulously careful with that.
That's good to know. Thank you. I remember you talking about that before, and it's always stuck with me. All right, and we'll get to the questions at the very end. We're almost there, folks. I have one more question to ask Dr. Trish. What advice do you have for pet owners regarding preventive medicine and maintenance of the overall health of their animals?
I would include preventative life plan instead of medicine, because when we think of preventative medicine, we think of we're going to give a flea pill and a heartworm pill and some vaccines kind of thing. And we really want to turn that around and not just say that we don't need a vaccine or heartworm prevention or whatever, but to really look at why do certain pets get lots of fleas and others don't? Because fleas seek heat and inflammation is heat. And so if you have a pet with a lot more inflammation, you're going to have a lot more trouble controlling the fleas on that pet. And so maybe if we do some things to get that whole body healthier, it won't be as much of a targeted product target for the parasites. We have to realize parasites are going to seek out the weakest thing. It's trying to get through the easiest life it can as well. And so we want to work through that and look at not only food, not only supplements. Yes, let's use what vaccines we have, but minimize them. Yes, let's use whatever appropriate diets work best for that pet, whether that be age of pet or whether that be unique to that pet's disease or health condition, or whether that be to a specific breed. And to a breed, I look at it as more what health conditions are they more prone to than other things commonly. And then we want to have that forward plan when we talk about maintenance. If we've got that pet that has allergies, or we've got that pet that is prone to getting irritable bowel and blowout colitis from stress and things, we want to have that weekend plan of, okay, when we know these happen, we know life is not static. There are things that are going to be involved in these pets' lives that throw us a curveball. And so we want to have what's our backup plan instead of just rush to the nearest emergency center for massive amounts of medications. If we need that, absolutely. But that's kind of my life of getting a plan together. Heck, down here, we have them get a hurricane plan together. What are you going to do? I mean, we're right on the Gulf Coast, and there's not even a mile between the main road and the Gulf of Mexico. And so it's of course, it's all this wonderful right on the water. So there's lots of people that live there, but it all floods as soon as a hurricane starts coming in. And so, we tell people you've got to have a hurricane plan. If you don't, there are people that don't vaccinate their pets. They're going to make their own decision, and I'm okay with that. But I will absolutely say, what are you going to do when you have to evacuate? Because you live in an evacuation area that every time we get a bad storm, you're out and you're in a shelter and you're living in your car with your pet, because if it doesn't have a rabies vaccine, you're not getting in that shelter. And, and you feed raw food. That's great. You're going to be out of electricity for a week. So what are you going to feed them after the first day? And so I keep around some kind of the things that I consider, yes, it's a canned, or yes, it's a freeze dried, or yes, but it's as close as we can get to your raw. And so part of your buy batteries and flashlights and this bit is make sure that you have 1 to 2 weeks of a shelf stable food that you can feed your pet if you home prepare or raw food or frozen food or any of that stuff. And so, all in my neck of the woods, that has to be part of their maintenance and preventative plans as well.
Yes, I understand that. That's good to know. And yeah, unfortunately, you've had to deal with that over the years.
Yeah.
I was just talking about one tornado that hit down in Ontario a couple weeks ago, and you're experiencing these things definitely on a more regular basis than what we see here. So that is definitely something to think of a plan. And I like your advice on the plan idea. All right, so thank you so much for answering all of my questions. And now we're going to go to the group, and we've got, let me go to Margaret's question, because
Questions.
Margaret had been given anti-flam, was given to her horses, our equine anti-flam.
Yep.
And looking about the monocytes, the vet had said, I believe, if I remember this correctly, Margaret, there was an increase in the number of monocytes, and wondering if the anti-flam would have contributed to that. But I don't know that it would have, because it would have calmed the inflammation versus having the opposite effect. Or what do you think of that?
I do have a very few animals, but I do tell people every animal is going to be unique, and it can be an herb that's meant to do the best thing in the world, but you can have a unique animal that has an inflammatory response to that herb. I've got a handful of pets that if I give them the probiotic, they will blow diarrhea that night, and every time I give it. So I give them the Ultra Pro. I'm like, okay, one of those herbs that's meant to calm down irritable bowel doesn't work with that pet. And so we have to go, okay, we still want the quality probiotic. So I just get them the human capsule, Ultra Pro, and have them do that. And I can't tell you which one it is, but there's that very few. And I laugh because one of my technicians, her dogs and she can't take the healthy colon or she will absolutely blow. And so she has to take the healthy pro, and both of her Labradoodles do not tolerate the probiotic 8. They have to take the healthy pro. So I'm like, well, like mom, like sons, scenario. So is there a possibility that one unique individual might have an inflammatory? And again, if it's monocytes, eosinophils, those are ones that we would find reactive at the gut lining. And so is there a possibility? Yes, it would be fairly mild when we're looking at systemic blood supply. What's in the blood. So it's a possibility, but you're right. It's going to be that one here and there. In general, it's going to bring that down, and it's going to be inflammatory, anti-inflammatory. Now, but the thing to look at is what was the rest of the white blood cells. So if the lymphocytes were up as well, or were on the upper end, or if they were really low, we use up our lymphocytes to fight a virus. That's what breaks apart to become the antibodies to tag a virus so that your neutrophils can see it. And so sometimes if we're struggling with a virus, we go to the doctor and they test us for Epstein-Barr and mono and all of this stuff. We don't have those tests in the veterinary world. So all we can do is look at fluctuations in the different white blood cells to see what potentially could be going on. If I have a crazy high neutrophil count, those are our garbage trucks. They're running around cleaning up and engulfing debris. So maybe it's bacterial or other damaged cells that are getting cleaned up. If I've got the eosinophils, okay, that's an allergic, and that could be parasite or others. Monocytes are more inflammation along membranes. And so, but I would also be looking at, is the horse having any airway issues that have nothing to do with we're using it for muscle or this, bit, and the other? If they're in my neck of the woods and they've got any airway inflammatory issues, you're going to see monocytes up because of some allergic and respiratory issues.
Okay, so, all horses in the barn on anti-flam had increased mono levels. So vet thinks it's the way the herbs work, but was uncertain. Tests were fine. Rest of levels were fine. Based on
and so again, that's where I look at if it's just a mild shift, I'm just not going to worry about it.
Yeah, that's what I kind of thought. And I went through the monograph of anti-flam and all the ingredients, and I didn't see anything that would be kind of cause and effect there. I didn't think it would be a problem there. Next question, thoughts on feeding for the breed. What about, say, a young shepherd versus a Chihuahua?
And so we've got several circumstances, at least in the United States. We have bred pancreatic insufficiency into our shepherds. And so I'm much more paying attention to what is that dog eating? How much is that dog eating? And how much is that dog defecating? Because if the dog's eating a reasonable food, they're roughly 75% digestible as a ballpark. So if the dog's eating 4 cups a day, all of its poops together shouldn't be much more than a cup. And so if you're like, my God, that shepherd, I think I have a small pony out back, that dog needs an enzyme. That dog's got some stuff going on gut. And then what's the work? And so again, a dog to a dog, we may not see, we still want to be a 60 to 70% carnivore and things of that nature, but we want to see what their unique problems are. Chihuahuas, we don't see as much digestive issues, but in general, but I do tend to find that they also don't have as much pancreatic function. I've had Chihuahuas on, and I always tell people, the Shepherd is my large breed that, other than miniature Schnauzers and miniature Poodles, that I have to visit more enzymes on. But my God, sometimes I have to put Chihuahuas on as much enzymes as a Shepherd. And so it's more keeping a good balanced food. Is the Chihuahua going to be working as hard as that Shepherd and out playing ball and this, bit, and the other? And so again, do we need as much protein? Are they building as much muscle? Are they working as much muscle? We're not into agility and stuff with Chihuahuas. So I still think it's not necessarily breed specific, but size, use, and inherent problems that are prone for that breed. Now, Chihuahuas are one of the higher ones for heart problems. So I'm not opposed to people using a taurine based product just to go, okay, maybe we can feed the heart a little bit better. The Chihuahuas are a breed that is really prone to getting basically osteoporosis of the front upper jaws and lower jaws. So that's why they lose all their little incisors, not because they rotted them out, because they literally lost the bone and there's nothing holding them in. And so sometimes I'll put them on a supplement to kind of help stabilize that if we start seeing that. So again, I more look at here is based on that breed, what problems I see are more common and what might we suggest diet-wise, nutrition-wise to suit that.
And diet-wise, for dogs that are prone to allergies in their specific breed, other than probiotics, what types of diets would you recommend? Raw or less grain, or what do you normally suggest?
So certainly less grain. Again, back to the first two ingredients have to be animal. If they've got a little oatmeal or rye, but some of these you get their grain free, and you look on the ingredient, or the first and second ingredient is the sweet potato. Like, okay, and you failed my test. I need 2/3 of that diet to be animal. And so grain-free is not all the option as well. And there are some concerns. They haven't been validated, but there's nothing wrong with further testing. We don't think the grain-free pets are, the grain-free diets are, causing these heart disease issues. There may be some slight, is there enough sulfur to make taurine, or is it interfering with sulfur or things? But there's so many factors in heart disease. If it were just that food, there are millions of dogs on these grain-free foods. We would see, a good 35-40% is, think of what I read statistically, of these dogs having heart problems, and we're just not. So could in some few dogs it be a factor? Yeah, it may be. But then we get into, the miniature Schnauzers. Again, their pancreas walking around. I'm going to keep them on whitefish and chicken and just easier to digest proteins. I'm going to keep them on easier fat. I'm going to watch things. As far as allergies, why there's 9 million proteins. You go, we're going to feed them lamb, and then we're going to feed them chicken, and then we're going to feed them kangaroo, and then we're going to feed them, gerbil, and then we're going to, because they talk about, let's feed them a novel protein that they're not used to, that they haven't seen before, so they're not allergic to it. Completely good idea. But if the leaky gut or irritable bowel is still there, they're not allergic to it yet. But that protein is going to leak through their gut wall into their bloodstream, be seen by their body, have a reaction. And if they keep leaking that same protein, eventually the body says, I need to assign warriors to this invading thing. And so they make antibodies to it. And now they're officially allergic to it.
Okay.
And so you change foods and you leave the gut, as crappy as it was, they become allergic to more and more and more things.
Thank you. We have a one of our retailers asking a question. A pet parent came to her about her dog that eats everything. He consumes toys, clothing, baked goods from the counter, anything. He's on probiotic 8 and pumpkin with his food, which is a good food, but this sounds like something isn't working correctly. What are your thoughts?
So again, double check the food. Is it a good food? And so we go, okay, it's a pretty reasonable food. It's whatever from Pure Vita, Blue. There's a lot. For Health, Taste of the Wild. There's a lot of good ones out there. I go, at least in the right ballpark. There are better ones, but again, follows those 3 simple rules. First 2 words had a heartbeat, no wheat, corn, and soy, no byproducts. You're at least in a good neighborhood. Then we have to look at how much are they eating and how much are they defecating. And if they're defecating more than roughly 1/3 of their eating, they're not absorbing the nutrition from their food. So we need to add a digestive enzyme. Beyond that, if we go, nope, they've got little poops and all of that's good, then we want to look at, let's pick up our Nutrify and our OptiPet, because if that pet, unique to themselves, has a higher need or is dealing with a past deficiency of some micronutrient, they're going to be out looking for that micronutrient. And we feel that a good number of dogs, that's why they have this pica, which is eating things they shouldn't. And so at that point, I go, well, okay, let's throw a whole bunch of a good quality vitamin and mineral on top of their balanced food. Full dose for a full dog their size, and watch them for 6 weeks. And if in 6 weeks you're like, oh, look at that, they stop doing that, then we want to cold turkey stop those vitamin supplements. And if the dog never goes back to it, we had a temporary deficiency the dog was just struggling to fix. We gave them 6 weeks of it, it was fixed. Remember it in the past, they may have real slow declines. So a year later, they may go to, oh crap, here they're trying to eat a sock again. Fine, give them another 6 weeks of the supplement. And if you cold turkey stop them and you go, oh, in a short period of time, they're right back to it. Okay, that dog unique to that pet has a higher vitamin mineral than quote unquote balanced pet food. And they're going to be as unique as us. And so I go, great. So they're the ones that are going to get those supplements for life. Put them back on at full dose, get them satisfied, and then start very slightly lowering the dose once a week until we get to, I got to a quarter of a teaspoon and I started getting that beady-eyed look again. So a third of a teaspoon must be what it needs. And then that pet's going to maintain it forever.
Wonderful. Thank you. And by the way, I'm going to be sending a link to this recorded interview to everybody tomorrow so you can revisit it and listen to it again, because there's a lot of great information here that Dr. Trish is sharing with everyone. So you'll be able to go back and revisit that. And I will again send that link to her wonderful website where there's even more information. So thank you for all these questions and comments. And thank you, Dr. Trish, for your very detailed and thorough answers. Do we have any more questions for Dr. Trish before we log off?
I want to make one comment back to Margaret.
Yes.
As far as the vet said the tests were fine.
Okay, yes, go ahead.
Fine in what way? Because these are ranges, and actually how 40 years ago, how our laboratories got the reference ranges they use is they tested healthy animals. We had lots of nutritional studies going on in the 70s and 80s. So we had lots of young animals of every species sitting around eating food, getting blood work done. And so that's how they developed these optimal health reference ranges. 20 years ago or so, they stopped doing that. The human labs stopped doing it first. The veterinary labs followed. And so now what they do is every lab, we send all of our blood work into the lab, and their computer saves all of the results of all of the animals per species that's sent out. And every 6 months, that computer randomly plucks 1,000 samples out and statistically evaluates it. And that is the reference range for that laboratory. So you can literally have a pet in Florida and pull blood, and fly to Seattle and pull blood, and you can get different reference ranges because they're only statistically evaluating what percentage to their regional lab. Secondarily, they just mixed all the sick pets in with the healthy pets. And so now we had reference ranges that went all over the place because they averaged in unhealthy. And whether it's because doctors got tired of trying to explain why you're one notch out of and why they can't fix it, or whether it's just that one notch out isn't bad enough for the medicine and they don't want to have that conversation and we got to wait till it's way worse because the medicine's not so cool. I don't know. But, you know, when I look at reference ranges, I took a whole course load on basically how to evaluate blood values and chemistries based on if this one goes up, you can see this one shift a little bit, and how do they all interconnect and what is optimal health. We may not be able to get there, but can we head there? And, you know, when we look at some of these reference ranges, we'll have age variations, we'll have breed variations, we'll have all sex variations, whether they're intact or neutered or spayed, and that can vary those reference ranges. And so, you know, the more you can know about that, the better, because there's lots of times that I get pets come in and they go, oh no, my vet said the blood work was fine. And I'm like, okay, but their opinion is, here are some, what I'm looking for is very early shifts to indicate Not that I need a medicine, that I've got a disease state, but that I'm showing some weaknesses and imbalance in the body. And there may be something nutritionally, homeopathically, herbally, whatever, that I can do to help that out before it becomes a crisis.
Excellent. Thank you for that. And Margaret, thank you for your question. We all appreciate that. And as Melody says, I couldn't agree more, Melody. I love listening to your insights. Melody's saying, I love listening to your insights on all things to do with pet health. I could actually sit and listen to you talk all day long. Unfortunately, we can't do that, but I concur 100%, Melody. And I think we have another question here. Oh, within normal ranges, it states compared to the year over year. Good question on source of normal. Yes, I agree with that.
And, when I do look at if you've got multiple blood works compared to where they were, and if you see a trend, even if all of them are in the reference range, a trend is a trend. What's going on? What's behind it? How can we help prevent it until it gets to crisis? Because our blood work is diagnosing train wrecks. You have to have more than 60% of your liver screwed up before your liver values change if it's not something acute toxic. You can give half your liver away and regenerate more. You can give a whole kidney away. We only need 50% of one kidney working to keep everything going. So a lot of times we either had an acute injury, which is oftentimes what we're doing acute blood work for, but this just monitor it over time. By the time those numbers are skewed, we are so far down the train wreck that, we're too far gone. And so sometimes just at least being able to understand some of these things that go on. We don't even look at cholesterol. Cats are so prone to, and miniature horses, they're so prone to fatty liver. If your liver absorbs the waste products and can't process and get rid of them, you stop absorbing the cholesterol out of your bloodstream, but your cells still have to make it. And so you get an elevated cholesterol. So we need to pay attention to those animals' livers, just like we do people with fatty liver.
Yeah, and this again, back to a lot of animals are developing these issues or these health issues that we have, and a lot of it I know has to do with diet. But
Yeah.
Margaret added, happened to be mostly late teen geldings. They're riding horses that she was discussing, just so we have a little bit of an overview here.
Where is Margaret?
Margaret, where does she live?
Yeah, geographically, where are these horses?
I believe they are in the Maritimes, the east coast of Canada, in the Maritimes.
Okay, because then we start looking at some benign infectious diseases that can blow through them and not cause any issues, but you can see some fluctuations just because it's the season up.
Yeah,
down here because the kennels, the agility groups and all the show groups come through, we'll have canine influenza come through. I don't vaccinate for it. I make a homeopathic for it and send all my dogs on their way, and they're fine. But we can get some of these fluctuations in this, or if we got allergies going on again, if things are pollinating and you're like, oh, look at all the beautiful flowers everywhere, and you happen to test, oh, look, we've got a few monocytes up. That can just be some mild respiratory allergen reaction going on.
Yes. For a skin condition, our next question here, and it's interesting. I sense that we'd be getting more questions tonight, and look at what's happening. For a skin condition where it's become red and fur falls out, would you look at gut health first as well as been recurring?
Yes. So we always go to gut health, always go to nutrition, and always go to digestion. So we're back to that probiotic 8, potentially some healthy pet, making sure we're on a good food. Depending on the breed, we may stay with the whiter proteins so they're easy to digest and lower fat and all of that stuff. And then I make up a little concoction with lavender, tea tree oil, and colloidal silver and water and slab that on, because the tea tree oil calms the irritation of the skin. The colloidal silver is an antibacterial, antifungal, and the lavender tends to boost the immune system a little bit. So I make it up in a water solution and apply it ad nauseum. Just to topically calm down some things a little bit, because once we get the redness to the skin, now that area is more prone to just let opportunistic secondary bacteria and yeast get in, which then makes them more itchy and more red. And so we can have multiple reasons that coalesce onto each other.
Excellent. And Melody, I know, always has is very much about label reading, so she shared that with her friends. So that's good. Thank you, Melody. See, you're passing all this great information along. Any other questions or comments? Thank you, everybody, for this has become a very immersive situation here, which is always good. We always learn from shares and questions, so thank you. Anything else for Dr. Trish before we leave for the evening? Well, thank you, everybody. And thank you, Dr. Trish, for your time. We really appreciate it.
You are very welcome.
It's always a pleasure. And again, I will send everybody a link to the recording. You can revisit it. And of course, you can reach out to Dr. Trish if you'd like, whether it's for a consult or whatever the case might be. She's definitely there to help. So thank you so much again, Dr. Trish. Thank you, everyone, for joining us tonight. It's really been a pleasure.
Everyone have a great evening.
Yes, you too.
Bye-bye.
Thank you. Good night, everybody.